Hey guys, and welcome back to the Root Cause Medicine podcast. I'm your host for today, Dr. Kate Kresge, and we have a brilliant episode for you if you're someone who loves kids, whether you're a parent, grandparent, teacher, aunt, uncle, you name it. If you care about keeping your kids healthy, this episode's for you. So all of us know the kid who is constantly sick, or we wish our kids got sick less often. But how do you safely help a child reach their optimal immunity? How do you actually prepare them to go in a room full of other sick kiddos and maybe reduce their chances of coming out sick, or at least reduce the severity of the illness they get? We're going to cover that and so much more with Dr. Chris Magryta. Dr. Magryta is an integrative pediatrician at Salisbury Pediatric Associates. He's the medical director there, and he's also the chairman of Children First of North Carolina. I met Dr. Chris by watching him present at a conference, and I was blown away by the information he shared. He's one of the smartest people I know, and he has a really amazing talent for finding the latest research and immediately applying it to clinical practice. What I love about his practice is that it's really conventional in the sense that they see people in a conventional model with insurance, and yet they still are able to weave in natural, evidence-based interventions into each appointment. I really love the practical, tactical advice that we get from Dr. Chris, and we're going to start with immunity and also go through things like how to optimize your child's whole person health, including their brain health in the first few years of life. We're going to talk about sleep, asthma, you name it. If you wish that you could have just sat down in front of an integrative pediatrician with decades of experience and picked their brain, this episode is going to feel just like that, and you're going to come away with so much more confidence and so many helpful takeaways. Dr. Chris, welcome to the Root Cause Medicine podcast.
Oh, it's a pleasure to be here, Kate. Thank you for the invitation. And as always, it's lovely to see you.
Likewise. I actually love the story of how we met. We met at the IFM conference, and I knew you were a pediatrician because you asked for my sparkly jacket. For reference, people who don't know this, when Rupa goes to conferences, we show up either in astronaut suits because we're the future of medicine. We're super goofy, super fun. And I had on this very oversized, what looked like, I think, a magician jacket. It was like blue and green sparklies. And I was thinking to myself, what am I going to do with this thing? Like when I go home, like I can't put it in my suitcase. It's going to like get all my clothes sparkly. And Dr. Chris showed up and said, I'll take it because my kids will love it.
Yeah. And I didn't think you'd send it to me, but there it comes in the mail a couple of days later. I started laughing and then I wore it and the kids laughed and loved it. So yeah, it was pretty awesome.
I love that it has a life of its own now. It's continuing to bring people joy. But that's where I learned that you run a huge pediatric clinic, and you have for a long time. And I've since listened to you give lectures and have really appreciated how well you understand the root cause of so many conditions that can feel really big and scary and baffling to parents. And so I'm so thrilled to have you here today. We could have you talk about anything, but what we're going to focus on today is immune resilience, asthma and infections. And I kind of wanted to start by just picking your brain. Like, I feel like this winter, I saw so many adults getting sick, but then if they had kids in school, they were just kind of throwing their hands up and being like, we're just going to be sick for the next 4 months. And I feel like there's got to be things we can do. And so can we start there?
Yeah, absolutely. And I love the intro and love the story of us. And I think that's sort of the beauty of life in medicine is spending time out there and just approaching with a wide open lens. And I think for me, that's the essence of root cause medicine is looking at everything wide open without a slanted view, without an allopathic view, without an Eastern view, without any kind of view it has to be. It's just, let's see what is the best and let's see what works. And so if we take that mindset and shift to what's going on, right? So I've been in practice now for 24 years in the same building, and we are dealing with more viral induced and bacterial induced illness than my entire career has seen. Now, if we go back to why, I think the major reason is COVID. I think what ended up happening was during COVID, we basically shut the kids out. They didn't go to school for a long time. They were locked away from each other. They didn't spread disease like they normally do. And so antibodies sort of disappeared. And we know this when you look at just COVID antibodies being tested after you get your viral infection or you get your vaccine, within 8 weeks to 6 months, your antibodies sort of disappear unless you get reinfected or re-exposed. So for roughly 1.5 to 2 years, kids lost their antibodies. Now, the reason being, if people are curious, is it's an evolutionary smart thing to do because antibodies are proteins. And so if you keep all of these circulating antibodies against all the thousands and thousands and thousands of microbes you can get exposed to, your blood would be thick and you'd die. So it can't do that. So it builds the proteins and lets them go away as needed. And we'll talk about B cells and T cells later and how they make these things. So the body just goes into what's called a memory phase. It just sits there quiescent, but your blood doesn't really have circulating antibodies that are ready to attack whatever pathogen jumps in the system. So fast forward to now. All of a sudden, kids are back in school. Kids are back with each other playing. COVID is sort of gone. The masks are gone. All of these things. And when I mean COVID's gone, I mean it's the virus is here, but we're not worried about it. We're not avoiding it. And so all of a sudden, the kids are now living with each other and they're swapping spit like they always do and snot and everything else. And if you ever want to see how kids do this, go to Walmart, sit in the toy section and be there for about a half hour. And in that half hour, you will see a child with a big snotty nose touch a bunch of toys, walk out. The next kid will come by, touch those same toys, pick his nose, touch her eyes, and you have the nidus of spread. And we'll talk about measles later, and measles will sit on an inanimate object for 2 hours. And viruses have different levels of amount of time they can survive there. So we know the spread is simple and easy. That's why kids spread so much disease. So then we sat there and said, okay, well, this is interesting. Now all of a sudden kids are getting sick constantly. Well, flu came back with a vengeance. RSV came back with a massive vengeance. And then you had your typical coronaviruses, which is your common cold rhinoviruses. And so essentially, you're basically a naive immune system with memory, but no active antibodies. And so kids get sick back to back to back to back to back. Part of it was unavoidable because of what we did with this experiment of COVID. But to your point, are there things you can do to reduce this problem? The answer is yes, right? So when we think about this, we have to look at it from a perspective of what does the immune system need to function well, right? And when I think of this, I think of sort of the pillars, right? And the first thing is most important for a child is sleep. If your child does not sleep well, their immune system will be wrecked. And we know this from study after study after study. But kids in general should be sleeping anywhere from 8 to 14 hours a night, depending on their age. And so screens have gotten in the way of this. I've seen a little bit of lack of parenting around this getting in the way of this. I've seen different things disrupting a child's natural sleep, iron deficiency. So anyone who's had a child knows that if they've not had a great night's sleep, what do? They're whiny, they're cranky, they're irritable. Well, your immune system's part of that game as well. And so one of the first things I tell folks is make sure your kid gets to sleep on time, right? Make sure that you set a boundary as a parent that you're not going to accept delayed sleep. So their immune system is constantly functioning at its best. And the super interesting anthropologic thing around this is when does your immune system turn on? Right? And this is sort of interesting. Your immune system turns on when the sun comes up. It follows circadian biology. And why would that be? Well, when do we all experience interaction with each other? When do we first eat? When you wake up. So your immune system cranks up in the morning, and then as the day goes on, it starts to wane again. So your immune system's the least active after the sun goes down, because what's supposed to happen after the sun goes down, according to our genetics? Well, the sun goes down and you go down. You're supposed to go to sleep. What do we not do now? So we're sort of a mismatch there. So sleep's my number one. Number two is nutrition, by far. And the reason nutrition is so important is because nutrition is a cofactor reality. And when I use the word cofactor, I'm speaking of minerals and vitamins and things that help enzymes work in your body. And in this case, specifically, we're talking about how those cofactors are helping your immune cells do their job. And we need lots of them. Zinc is a big player. And we know this because you think about just zinc deficiency. It's a disease called acrodermatitis enteropathica. Well, zinc insufficiency is sort of a similar problem where your immune system just doesn't function well. So I talk to parents about where they're getting their kids' intake of zinc. We talk about vitamin D. Everybody knows all about vitamin D. And everyone who follows your podcast knows you probably speak to this probably every podcast. And so vitamin D is a big player. And where are we supposed to get vitamin D? I'm a natural guy. So I'm sitting there going, okay, we can get this from food, but also you want to get it through the sun exposure, right? We want magnesium, right? This is another big player in this function of how the cells do the job, and then iron. Those are the sort of the big four. So in kids, I will test them, do blood and look and see. We'll test RBC zinc, which is red blood cell label zinc. So we get a 120-day cycle of what your zinc is doing, red blood cell magnesium. Iron, I test in general with ferritin to see how their stores are. And then vitamin D. And then we supplement if needed. But before you even get to that level of blood, I'm always telling folks, let's maximize where you're getting your sources of these. And if you're ever curious as parents, I encourage you to go to the Linus Pauling website for Oregon State University. They have a phenomenal micronutrient section where you can go through any micronutrient. You can read about what is involved in cycle structure-wise, cofactor-wise, what enzymes it's helping. And then it gives you a list of what foods have that. And that's where you start to say, okay, how do we get these foods in our kids, right? And then what else is involved in immune health? Exercise, movement, hugely involved in that. So get the kids out. Now, that's generally not a huge problem for young kids, but as they get older, it becomes a problem because they're on their bloody phones and all these other things that are sort of structurally dysfunctional. So that's sort of one I do encourage parents to get their kids outside, get their kids playing games, get their kids moving. And then stress reduction is always a big one. Now, that's a much harder lever to pull on because usually the stress is familial or something at school and you have to really get involved in that. But I'm always telling folks to help their kids do box breathing, 4-7-8 breathing, get them involved in listening to music, relaxation, all that stuff. So that's sort of a rapid primer through a very long story.
So we might have some parents at home who are thinking, well, I wish I could get my kid to sleep, but my kid has a hard time falling asleep, or my kid wakes up in the middle of the night. Do you have some favorite tricks for sleep?
Yeah. So biggest thing by far is routine. Kids are creatures of habit. So if they know the brain is Pavlovianly, the Pavlov's dog study, the brain knows that when it's starting to go through a pattern repeatedly, we'll start to accept that pattern and start to keep that pattern going. So if you have your child that's young and you have 6 p.m. dinner, 7 p.m. bath time, 7:30 reading, they'll start falling asleep regularly at that time, especially if you keep the lights in the house dim, you don't have lots of lighting, you don't fight your natural circadian biology. Because again, the sun goes down. As the sun is leaving the sky and it's getting dark, the light changes entering your eye. The photons actually send the signal to your brain to turn on melatonin. Cortisol is supposed to drop, adenosine is supposed to drop, and then you fall into the sleep pattern. If you fight that by light spectrum that actually suppresses melatonin's effect and raises cortisol because you're hyperexcitable, you're playing video games, well, then you're going to make it harder for you to fall asleep. So I'm always a fan of what was intended. So go back to what nature asked. So that's number one. If they wake up in the middle of the night, then I'm worried about iron deficiency because iron is very important in sleep biology. And it's not a sleep onset problem. It's often a sleep maintenance problem. We learned this from the neurologists who figured out that restless leg syndrome was highly associated with iron deficiency. And this is not a issue of an anemic problem. You can have totally normal CBC with normal blood count, but you just don't have enough iron for storage in the ferritin cages. And so that's somewhere where I'd say, okay, get an iron level through ferritin. And if it's low, then you want to supplement that back. In the absence of those two, then avoiding caffeine, all the basics, sodas, things like that, that might keep your kid up. And then trying to make their sleep environment as dark as possible. Dimmers in the rooms, even red lights now are getting super interesting.
What do you mean by that?
So red light therapy, right? So there's all this data. And again, I'm not an expert in this, so I'm going to probably butcher it, but the wavelengths of the sun have a certain spectrum from like 460 to 600 nanometers, I think is what it is, or angstroms. But below that, there's the infrared, and above that, there's another wavelength. And those wavelengths also are functional, it turns out. And there's some healing biologic effects that this is the way we see as the sun goes down. These other wavelengths are there as well. And so there's some data now coming out that having red lights at night actually induces healing inside the body via these pathways that have been with us forever through the sun and the moon that we just avoid because we're indoors too much. And so there's a lot of folks now who talk about having red lights in the rooms when the sun goes down because you can still see and do, but you're not actually getting incandescent lights like you would from the sun. So it actually turns on all the biologic effects we want.
That's awesome. So maybe putting some red lights in your kid's room.
Yeah, I'm actually really interested in doing full spectrum lights at home and then red lights at night, everything. So that's a deep dive I've done in circadian biology recently. So I'm about to head down this road big time.
So let's wrap sleep up. I want to ask you about the kids who do use their phones a lot, because I'm sure you run into this all the time. Like, have you learned some successful hacks for helping kids and teenagers stop using the phone at night so they can get restful sleep?
Depends on the age, right? So if they're of the age where you have a little bit more control over what they're doing, well, you just have to parent up and say, no, take the phone away. You have give them limits on it and be very authoritative, not authoritarian, but like, I love you too much to let you do this to yourself. So let's have a conversation on how much time you're going to be allowed. And if I catch you going longer than that, we'll take it away for a bit until you can start to recognize what is healthy for you. Because given the absence of parenting, children will do what children do, which is to have fun and not worry about the consequences of their behavior. And there's so many downstream bad things that happen from a screen, right? The most common thing that I'm seeing now, other than inattention, is kids are going worse in their ability to see distance. So they're becoming more myopic because they're spending so much time staring close to these screens that their eye shape is changing, and they're having to get glasses now more frequently. And this is something that's been well seen in Far East Asia and Korea and Japan for a long time. So I let parents know all of those details. Like, here are the things that are going to happen to your child if you don't change this. And that sort of gives parents a lot more fear, which I hate using that as a metric to why. But if fear makes change in the right direction, fear is useful. Right. So I think we leverage the things that are going to be detrimental to the child and have the parents parent up on that. When they become teenagers, like car driving teenagers, a lot harder because they can be out of your purview a lot. So then I go to let's look at your screen usage. Right. So I ask them to give me your phone. Let me see your screen usage. Oh boy, if you can't get below this, your phone's going to have to come back to me and I'll hold it for a while. Or we can get your flip phone. And the statement of flipping to a flip phone will make every teenager run for the hills. And so that's a good motivator. And again, this is not, in my mind, draconian parenting. This is effective parenting, because if and when they realize that you're serious, behavior change occurs. And again, you're not being mean. You're not saying you can't have your phone in the future. You're just saying, let's limit the time. So when you adjust your time course back, then we'll give you the phone back. Sort of like if they were driving a car drunk, would you say, oh, it's okay? No, you'd say your car's gone. Right. But somehow we think that phones are a right. They're not a right. They're a privilege. Just like many things children have, they're a privilege, and we shouldn't be giving them as a right. And somehow we've normalized way too many things for kids. And I'm a little bit old school. I think we should just say, I love you too much. Here's what we're going to do.
It's helpful to hear. I mean, especially you've been doing pediatrics now for 24 years. I think a lot of parents feel this impulse, but then they're alone in the battle with the kid, and everybody else is doing it, and everybody else's parent is letting them do it. And it can be really hard to stand strong around that. And I think knowing the science and having an appropriate level of concern is really useful. And I love the science you shared today about that.
Yeah. Let me add one little piece to this for the parents listening. When you parent up, your kid will thank you. They won't thank you in the moment. They won't thank you the year later. But when they're older, mine just turned 20 and 18. My 20-year-old has said to me over and over again how grateful he is for what we did around these issues, because he's now watching friends that are in school who have no control, no self-wisdom around these decision-making pieces. And now they have this control group that they can look at that says, wow, my parents love me enough to do this. And it comes back full circle after all the pain and struggle and arguing and fighting. Eventually you're like, wow, it was the right thing. And my kids are even saying, like, when they have kids, they're not even gonna have phones. Like, it's that funny. It's like, Dad, I don't know how you did it, because when my kids are born, they're not getting phones ever. And I'm like, I'm waiting to see, because I'll be the grandparent laughing.
You mentioned magnesium, zinc, iron, vitamin D. Do you have any favorite foods that you suggest to parents? Or like maybe the kids can't take pills. How do people get more of these nutrients in their diet?
The simple answer is vary up your foods constantly and always choose whole foods. That's a big one, right? So one of the easiest ways to get a lot of these things in your kid is liver, right? So it's something nobody eats, right? And unfortunately, if you watch an animal eat another animal, the liver is one of the first things it eats. So I saw this live. It was the coolest thing ever. I was in Wyoming on a ranch, and a little dog was there. It was like a terrier kind. And I saw him take off out of the distance. And then all of a sudden you catch a little, they called them chiselers. It looked like a little prairie dog. And it flipped the prairie dog on its back, gutted it, and then ran away. Didn't eat any of the muscle. It ate only internal organs. And so that was a real big wake-up call for me. Mother Nature always had a plan. And why do we eat the chicken breast, the least healthy part of the chicken, over the other parts where we have storage of all the good quality micronutrients? So Nicole, my wife, who's a nutritionist and an amazing chef, has made liver burgers, different ways to get in the kids that we taste tested, and the children had no idea there was liver in it. So you figured out how much liver you can put in to make the burger not taste like liver, which is a very specific taste. but also have a lot of those health nutrients in it. So a lot of that involves cooking. So liver is one big one I recommend. I do love a lot of beans and nuts. They have a lot of magnesium in them. So I'm encouraging folks to eat beans and nuts. Zinc is in shellfish. So I encourage folks to give their kids shrimp. Salmon is a great source of vitamin D. So you really just got to pick through foods that are not typically on the kid's plate. And you say, this is, again, I love you too much. Here's the food, right? And if you don't want to eat it, call me when you're hungry, and you bring out the same plate, right? You get away from this McDonald's Happy Meal world that is wrecking our children. Even if you look at school food, it's abominable that the United States government, as rich as we are, we allow children to eat high calorie, nutrient poor food, 66% of the meals they eat per day. It's terrible.
You gave me your wife's book, and it is one of my favorites. I actually have to find it so I can show everybody. It's called Nourish Your Tribe, but I want everyone to see it who's watching on YouTube. And it's brilliant. And you have some of these recipes in here. Yeah, well, when you have an RD as a mom and a doctor as a dad, I love under the Nourish Your Tribe, it says boost your child's immune system, conquer chronic illness, restore family gut health, sharpen the teenage brain function, optimize gene expression. Like, with delicious recipes, everyone needs to go buy this book. And we need to have Nicole on with you next time to like talk about this in more in depth. But I love that advice. I mean, we talk about the attention trail mix whenever I do ADHD talks, because you can throw like pumpkin seeds and almonds in there, which are going to be really good sources of magnesium. You can throw some cashews in there, some walnuts, really good source of omega-3s. And that's portable. Like, you keep a bag of that in your purse, and like the kids can munch on that all throughout the day. It's full of fiber, but it's got those really critical minerals and fats that your body needs for so many things, including brain development.
Yeah, well, brain development's massive. I mean, that was one of the big talks that I did last year at AIC, was all about the growing brain, and micronutrients, the cofactors, are so important in every aspect of neurogenesis. And that's one of the biggest worries I have, is that pregnant mothers aren't getting the sources of nutrients that they need. And it's a long conversation, but I think that's one of the major reasons behind the epidemic that we're seeing in neurodiversity and autism, is this whole world of micronutrient insufficiency, deficiency coupled to toxins. It's just a mess.
So you didn't say a multivitamin. So I'm curious, your thoughts. Like, do you recommend multivitamins for your pediatric population? Like, how do you feel about them?
I have no problem with them. I don't like them as a substitute for healthy eating. So when I hear parents say to me, oh, well, he's got a multivitamin, he's okay. No, sorry. The human body is far too smart to take a multivitamin as the main source of how it heals itself. I think the way synergy of food works together is very, very critical to outcomes. And I think Kara Fitzgerald's work, I think, is heading down this path of learning how epigenetics works through food as a synergistic model. I don't think supplements are the answer to true healing. I think supplements are a very good help in certain situations where you know the biochemical dysfunction, but I don't like it as an answer to not doing the parenting. If you say to me, I want to hedge my bets against holes in their diet randomly, sure, fine, all day long. I think that's great, but I don't like it other than that.
That's fair. Do you have a brand or a forum that you do like when parents are thinking, okay, doc, I'll do my best. It's going to take us a while to get here as a family. I want some nutrition insurance in the meantime, because I'm going to start with carrots once a day and I'll get to the liver in a year or two.
Yeah. So absolutely. Vitamins are terrible tasting. So let's just get that out of the way. They're amines. That's where it gets the name vital amines, vitamin. And so amines are bitter. And if you have a bitter substance, your kids are not going to take it. End of story, right? That's why vegetables are harder for kids to eat than fruits, because they love sweet. They don't like bitter. So broccoli is a much harder sell to a child than, let's say, an orange. But when they add sugar to it in small volumes, it's palatable, and then they'll get it in. So I like Nordic Naturals, Nordic berries. And again, parents will say, well, they have sugar in them. Yeah, I get it. But show me a under 8-year-old who's going to take one that doesn't have sugar in it. And then the other one that I think is reasonable, Smarty Pants. I think that's a good one. When they get older, I like Garden of Life's multivitamin for men, for the teenage boys, and I go prenatal for the teenage girls who are menstruating. Because as soon as they start menstruating, as far as I'm concerned, they're prenatal. I don't care whether they're pregnant. I want them to be sufficiently available to have a child if they, by accident, have a child, so that child has the best chance of an outcome. So to that point, so that's fascinating, right? So here I am recommending a multivitamin every day for teenage girls, right? But I wouldn't say that first line for a little infant, right? Because The reality there is that you control the infant's behavior around food, right? You can control what they're exposed to. You cannot control your teenage daughter or teenage son easily around food. I have lived this. It's very difficult. So I am okay in that point, hedging my bets, knowing that I have less control over the child's outcome.
Yeah. Now you mentioned like wanting to make sure that the teenager's taking a prenatal. And I find that people are confused about the difference between a multivitamin and a prenatal because they're very, very similar, but there's like one or two key differences. What are the key differences in your mind?
So it's methylation, making sure they have the right forms of cofactors that drive epigenetics. And now that's what we sort of know now. Back in the old days, it was a way to prevent neural tube defects. We had a disease that we were talking about. We found out, oh, if you give folate, they don't get neural tube defects in the same amount. Now we know with Stephen Zeisel's work here in North Carolina, choline is a huge player. Multivitamins for women do not have enough choline in them. That's one thing. If for those listening, eggs are a great source of choline. So if you are a soon to be pregnant woman, I would encourage you to eat eggs. Rhonda Patrick does a great talk on this kind of stuff. And she was eating 4 eggs a day while pregnant to make sure she got her choline. Again, these are all massively important foods that drive the epigenetic cycle that reduces the risk of the child's development going awry.
Mm-hmm. This is awesome. Cool. Okay. I want to talk to you about measles because there was a recent measles outbreak. And I think a lot of parents were feeling nervous. A lot of parents were asking us about vitamin A and if they should be giving their kids high dose vitamin A. What have you been telling your folks in your clinic about measles and what they should do?
Yeah, so first let's describe what measles is. I've never seen measles. Let's just be honest, right? So measles disappeared once MMR was effectively given to most of the population. I have a partner who is 85. He's brilliant, smartest man in our clinic, still working 3 days a week. Love him, Dr. Kantz. He and I talked ad nauseum. When he was in Texas, he saw measles all the time. And measles is nasty. 1 in 1,000 kids who gets measles will get encephalitis. 1 in 10,000 of those kids will get SSPE or subacute sclerosing panencephalitis years later. So it's a bad disease, right? Highly infectious. Let me just give you the data. I wrote it down here. Omicron is about a reproductive rate of about a 12, right? And that's almost the same as measles. So reproductive rate means for every 1 person infected, 12 other people will get infected. Those 12 then go out into the community and infect 12 more. So now you're at 144. Those 144 now go out and infect 12 more. You're at 1728. Those 12 go out. Now you're at 20,736 people in 4 exposures. That's faster than almost anything on the planet, right? So measles and Omicron are roughly around the same infectivity. They're nasty, they're fast, they go. Your sickness essentially comes on usually 8 days, 9 days after you're exposed to somebody, and you have a 4-day period of feeling nothing before the symptoms turn on, and then things are sort of a mess, right? So that's sort of what it is. What does the actual virus present as? I've never seen it again. So I always reread the data to make sure I can catch up to what I'm going to see. It's a high fever, right? So it's not a low-grade fever. It's really high fever. It's a rash that starts on your head and heads down to your toes. You start coughing. You get body aches everywhere, sort of the very similar myalgic fever stuff you get with other viruses like the flu. You get a sore throat, you get really red eyes, and then there's this really pathognomonic thing called a Colic spot, which is a little white. It almost looks like yeast inside your mouth on the buccal mucosa, the sides of your mouth, but it sits on a red base, which yeast won't look like. So people can look this up online, Colic, K-O-P-L-I-K spots, right? If you ever see that in the kid's mouth with all these other symptoms, your child has measles. Now, here's the important part. Do not take your child straight to the doctor's office. Please do not do that. If you do that, you are going to put everybody else in that clinic at risk. So you need to call us or your provider and say, hey, I think my kid's got measles, and let's prepare for you to come in and be seen in a room where we can isolate them from everybody else and not allow that child to infect the whole environment. Because again, 1 in 1,000 kids will develop encephalitis, and that can kill you. So it's a really big deal, right? So then let's fast forward to what you're speaking to in the sense of the vitamin A story. Vitamin A, like vitamin D and actually bacteria in your gut, are heavily involved in immune regulation, right? One of the big things they do is they turn on this gene called FOXP3, forkhead box 3. That turns on T regulator cells. And for those who don't know what those are the military police for the immune system. When you have an infection, your body will ramp up an entire Army, Navy, Marines, and Air Force to kill whatever pathogen it's fighting against. When the infection is over or getting better, your immune system should then say, okay, we need to quiet you down. And those are the T regulator cells. They send out certain cytokines or chemical signals that say, okay, let's shut back down. Vitamin A, vitamin D, and your natural gut bugs actually induce this military police that says, all right, everybody go back into relaxation mode. But vitamin A also, when it attaches to a retinoic acid receptor, it also turns on the pathogen APCs or antigen presenting cells. So they accept the tissue or the protein of the virus or the bacterium and present it to the T cells to then train the B cells to make the antibodies, or have those T cells switch into the CD8 type, which is the effector killing type. These are the ones that actually go out and directly kill the cells that have virus in them. Vitamin A helps turn on those effective killer cells. So it's at the center of all of it. And so when I say to somebody, okay, should you take vitamin A? In general, I would say no, because A, D, E, and K are the 4 fat-soluble vitamins, right? They live within fat. The danger with that is you can get toxic with them. So too much A, too much D, too much E, and too much K is poisonous to the body. So you have to be very careful in saying, okay, just take a bunch of these things. Now, if you are actively sick, you know you are sick, then you can ramp up for 5 days with no risk. Like you can take 10,000 IUs, international units of vitamin A, you're not going to be in big trouble. But to say baseline, take vitamin A every day for a long period of time, I do not recommend that. Now, you can take beta carotene, not preformed retinol. You can take beta carotene through carrots and all that, and you'll never end up in trouble. It's only if you give the preformed retinol or the vitamin A as an analog that you can get into trouble with. So I don't recommend that, but I do recommend, again, where are you getting your vitamin A naturally? From food, right? And so what do we want to eat? The rainbow, red peppers, carrots, salmon, liver, again, great source of vitamin A. And so that's my sort of story around that piece. But the biggest thing is we just don't want to get sick with measles to begin with. So how do we do that? We just avoid measles by getting vaccinated. And again, there are those who may find that to be a controversial discussion. In 24 years of practice, I have never seen a child in our group, and we have thousands upon thousands upon thousands of kids that we see every week. I've never seen a case of measles-induced autism. And it's just my view of the world. And so I am not against the vaccine. For those folks that come to our clinic that want to delay it till 3, I'm generally okay with that as long as they're watching carefully for outbreaks and they vaccinate their kid if there's an outbreak nearby. But that's a risk they're taking. I would rather them get the vaccine at least by 2 years of age. But again, these are controversial for some folks. The really super interesting one, and I pulled this one just to read about in the journal Science in 2019. Dr. Mina did this article where she wrote about what measles actually does to our immune system. It's super fascinating. The measles virus directly wipes out our antibodies and memory to other infections and itself. So let me say that again. When you get sick with the measles, the actual virus, your immune system will lose antibody circulation against other infections. It eliminates them. So you actually become like a clean slate against other pathogens. And so your what we call humoral immunity or antibody response disappears in anywhere between, depending on the person, up to 3/4 of the people lose their immune response to other pathogens. So it sort of goes like that. We started this conversation around the COVID debt, right? Crazy, right? That's sort of the reality of this stuff. And I don't think we pay enough attention to how powerful infections can be if we don't see them. Right? And we don't see measles. So people think measles is no big deal. It's one of the nastiest pathogens out there other than the human-made new version of COVID.
I'm glad you're talking us through this. This is really helpful. I'm curious, a lot of moms who are pregnant are in a position where they're being talked to a lot about things they can do to amplify the immune system health of their baby when their baby's born, including like getting vaccinated for certain things. But are there nutrients? Are there lifestyle things? Like, how do you counsel pregnant moms about the best way to set their kiddo up for success when they're born?
Yeah, I go 1,000 days before they're even getting pregnant, right? So if we really want to have this conversation, it's a book I wrote a while ago that I never published. It's just sitting on my computer. Yeah, it's sort of comical, but it's just sitting there and it's gathering dust. But really, truly what it is you want to set the table for the ability of the child to have the best outcome. And how that starts is really going through the 4 pillars of health right out of the gate. So movement, stress reduction, nutrition, and toxin avoidance. Those are the big 4. And you could put in a 5 add sleep, right? Those 5 things will set the body up for the most likely chance or most likely outcome benefit for the child. Now, there's huge levers to pull on in there, right? So if we think about mom being pregnant, not even until the child's born, one of the biggest risk factors I think today for bad outcomes is the ingestion of fructose, and specifically as fruit sugar. And how does that come in? It comes in mostly through beverages like frappuccinos, like soda, like juice. All these sugared beverages hit the liver and turn on a cassette of genes in the body that actually are metabolic syndrome genes. And they all made a lot of sense 1,000, 2,000 years ago when we had boomer bust cycles and food exposure. So when you had calories, especially sugar calories, you wanted to store them so you could survive a famine. Well, those genes that are turned on induce fat deposition in the liver, fat deposition in the periphery, metabolic derangement of blood pressure, so elevated blood pressure, and foraging behavior. And the foraging behavior is the critical one, because what's happening is the body knows that when there's sugar around, it wants you to eat a ton of it. Why? Because that means you'll store more fat for the period of time when you run out of food. What doesn't happen anymore? We don't run out of food. So that foraging behavior drives more people to eat more, and specifically sugar. So pregnant women who are eating more and more of the sugar is driving dysfunction in the baby. Rick Johnson's work was fantastic here. We showed that they had delayed placentation in mothers who consume fructose, where actually the placenta, where the spiral arteries invade the placenta to bring oxygen in to start the metabolic cycle of the placenta, delayed weeks. That induced preeclampsia. And preeclampsia is one of the major reasons for preterm delivery. Oh, by the way, big risk factor for autism, right? So that's, to me, is the cycle of where we need to say, okay, sugar should be really limited or removed from the diet when pregnant.
And do you eat fruit or high fructose corn syrup? Or what do you mean when you say that?
I mean fruit in an Americanized, ultra-processed form. If you are eating, let's say, strawberries, the fiber will delay digestion. You won't get that smack to the liver in the same way. Now, if you eat 5 buckets of strawberries with nothing else, sorry, you're going to turn that on. And the orangutans have proven that when they sit in the jungle and eat fruit after fruit after fruit, they get fat. Why? To survive the winter where there's no fruit, right? So we know this happens, but in a normal human who eats normal volumes of fruit, fruit is excellent for you. It carries all kinds of these micronutrients that we talked about, great macronutrient structure, but it's just volumetric. No, it's more of the sugars, the cakes, the juices, the Kool-Aids, the sodas. We go deep into another pathway. I think humans have lived with real food for thousands of years. Why do we need processed food? And a podcast I did with Peter Unger, who's a dental anthropologist from the University of Arkansas, we talked about why humans are having so many problems with wisdom teeth, having so many problems with crowding of teeth, braces. The bottom line is we don't chew enough fibrous foods. And so by giving kids ultra pureed foods for the first year of life, we're actually destimulating the maxillary bone and the mandible to be constantly working, which is changing the shape, which is changing the growth. And so they're too small now. They can't hold all the teeth. So if you go to the jungles of Africa, you won't see these teeth problems. Why? Because they chew fibrous food. So I encourage parents now to chew real food. Let's give your kid real food. Let them chew, right? Be there, know how to deal with choking. You don't want to ever give them something that's big enough to choke on, but let's give them food to chew on. Like, let's do the real stuff. What did God intend? What did nature intend? Whatever you believe, let's go back to the way it always was meant to be and stop this modern American way of everything's got to be simple and peaceful. No, euthermia is terrible. Everything's terrible. We have to have cycles of swings of everything.
When you say know how to prevent choking, like know how to deal with choking, because did you say 4 months start having the kid chew?
Yeah, start having kid have food. Like, so again, what would they have done in the old days? Mom would have chewed something up and given it to the child to eat, right? So again, but it's tiny little pieces of stuff. What will the kid do if they can't eat it? They'll push it out. Their tongue will push it out when they're not ready. So you know a child's ready when they're taking something on their tongue and they're taking it down. Now, if it's in a nice, small, chewed up form and the child can sit and gum with it and play and work on it, they'll do it. And again, so people find this to be very, sort of to your point, like shocking. What did humans do for 3 million years, right? And so we sort of think about these things in the context of modern society. Well, modern society isn't doing everything right. And when I meet with the anthropologists and I understand what humans did forever, it makes a whole lot more sense. So understanding how to prevent choking is to not give a size that could get lodged in the airway. Be there the whole time. not let your child, when they're older, eating and running, all of the stuff, the basic, simple things, know what to do. Gravity's your best friend, head down, feet up, right? If something like that happened. But historically, I would not imagine that children choked a lot back 3 million years ago. I just don't think so. I think mothers made sure that they protected their children, right? And that's what we do. I mean, I don't, I'm the guy, but I know all moms are hyper focused on their children's outcome. So I think it comes down to finding the best source of food for the child that's natural, like peas. Take them, smash them up, and then give it to the kid, right? So they're not going to get hurt by that.
Wow, this is cool. So let me ask you, have you seen these new like suction things for choking? What do you think of those?
I have not used one, so I can't speak to actually seeing it work. I always worry when people try and get something out of the airway that they'll push it farther down. Gravity tends to be, in my mind, the best thing. Heimlich maneuver, gravity, it works 99% of the time. So I would say that's probably the best answer, is just to go old school. I always tell parents to tell their children never to try and get the thing if their sibling is choking, because they will push it farther down more likely and cause more problems. I've been in practice 25 years. I've never had a child die of choking. So let's go with honest risk here. Like, what are we talking about? Yeah, does it happen? Yes, it's a big deal. But does anyone die? No, in general, no, because we are all, in general, as parents, we're there to make sure nothing goes sideways. So take that all into context, I think, is probably the best answer.
Okay. So like, you're a fan of the flip them upside down, hit them on the back type of gravity.
Yeah. And it depends on age, right? If they're babies, you're going to push the belly and you're going to give the back blows. But there's all those videos online. I encourage everyone to go on to YouTube and pull up choking videos, and just the CPR side of it's very useful. I would lean that way unless somebody can show me great data that these suction devices are better.
Okay, cool. I love that I get to pick your brain about all this stuff. I know I'm like firing so many questions at you. I saw you present on asthma and I thought it was brilliant. And you just mentioned asthma. And so I'm curious, what do you think causes asthma?
What's the easiest way to say this without spending another hour? Break intolerance is probably what I'm going to say the most. And when I say tolerance, I mean the immune system's natural ability to see the outside world, what we call the exposome, and not overreact to it and think it's dangerous. So I think in context of the greatest risk factor, I think is probably related to an abnormal microbiome of the parent, coupled to host genetics, and then the fact that we're growing up in an overclean environment. I think COVID is going to drastically increase the volume of atopic disease because we were too clean for too long for these little kids. Tolerance is the function of the immune system. When you're born, you have a naive immune system, which means it's never been programmed to see anything other than what you may have been exposed to in the placenta, which is minimal things. The immune system then, once you're born, the first thing you do is slide through the vagina, and you get exposed to vaginal flora, bacteria and viruses and archaea that are in your vagina, and also, most of the time, stool. It's not a weird event that women defecate during pregnancy. It's actually more common than not. Why? Because that's your route of getting the mom's microbiome. We understand all this now. And so as you slide through the canal, you get exposed to these wonderful bacteria, those bacteria that enter the baby's mouth and nose. The immune system starts to see the pathogens, and think about how many pathogens you're getting all at once, right? The immune system then says, okay, I see you, I see you, I see you. It starts tasting all these little pieces of protein in these dendritic cells and APCs, and then chews up that protein and sends signals to all of what we call the thymus or the local lymph nodes and says, okay, buddy, we're going to train. We're going to educate you on who's good, who's bad, who's good, who's bad. And this process is very, very powerful. If that process is disrupted for some reason, C-section, not getting exposed to the right bacteria, mom's microbiome is actually dysfunctional, right? Because of Americanized behaviors or modern behaviors. Then the tolerance mechanism doesn't develop correctly. And then the immune system may see things that we see normally as bad. For example, a peanut, right? Child gets exposed to a peanut, and oh, by the way, the immune system says, oh, you must be a bacteria, I'm going to kill you. And then the child anaphylaxis is a problem. So the basics of that, to me, is where this is all coming from, right? So somewhere we have a break in tolerance, somewhere we have a break in how the immune system recognizes right from wrong. And then when that immune system then sees something else, it then sends out the signals that we see of as disease. So for example, if you have milk protein intolerance, which is a huge problem in our clinic, where the child is given a cow milk formula or they're getting exposed to cow milk through mom's breast milk, the immune system sees that as an invader and starts to attack it. And these child present all the time by 3 to 4 weeks of age with colic, green stools, eczema, which is a skin rash that's called atopic dermatitis. They have wheezing when they get a little bit older, and they're chronically congested. Well, that's a marker of immune response to that consistently ingested milk protein that then leaves the kid looking sick, right? When I started medicine, Magryta UVA, got great education, thought I knew the world of this stuff. The answer was creams and medicine. Nobody's asking the question, why is this happening? Well, the reason it's happening is because the tolerance broke and the immune system is overreacting to things that should be normal. So the why is not genetic, right? So yes, genes are involved in everything. Genes are involved in why you're predisposed to Alzheimer's and I'm not, or vice versa, or whatever. But those genes aren't your destiny unless you turn them on. And so the epigenetics reality, when I interviewed Randy Jerdal and Moshe Schiff, that was the story that said, okay, now we get this. There is something happening in the environment that's driving the immune system to be angry. And it's not pathologically angry, like it doesn't want to hurt us. It is angry that it thinks it's taking care of these things that keep bombarding our body. And oh, by the way, that happens to be cow's milk, or it happens to be peanut, or it happens to be pollen, it happens to be dust. So the story is the exposome or the external environment that's driving this tolerance to not be functional. And so in the end of the game, what do we really need to do? We need to go back to what nature intended. Be exposed to bacteria naturally, deliver vaginally, breastfeed, do all the things like avoid toxins that trigger immune responses, all these things that are negative towards the body, endocrine disrupting chemicals. I mean, again, we can go on and on and on, thousands of different things. But if you go back, like my wife and I talk about ourselves as tree huggers with iPhones. Like I want to be as clean as I can, living like 1850, but I want to have my iPhone to be able to connect and do and read and get on the internet, whatever, right? So yeah.
I love that. So let's say a parent comes in, their kid just got diagnosed with asthma. They have a whole list of medications and inhalers and all the things. What's some of the first things you tell them to do, or are there tests that you run? Like, how do you get them started on a path to actually healing the root cause?
First question, did you have colic as a baby? Absolute first question. Again, this is assuming we've diagnosed them with asthma already, right? And just so we dial back 1 second here for the parents listening, if your child coughs when they run, they cough at night, and they cough in the morning, but otherwise are pretty well, that's asthma. And especially if you have a family history of asthma, you or your husband, if it's mom I'm talking to, or you or your wife, if it's dad I'm talking to, this is the story of asthma. And it's often missed because people aren't paying attention. My kid just coughs a lot when they run. He just doesn't look right. He's slowing down fast. Kids, that's asthma. And especially if they're over the age of 3. If they're under the age of 3, it can be just small lung tubes that Fernando Martinez figured out, and that they usually outgrow. But that being said, if we think it's asthma or we know it's asthma, first question, was your child colicky as a baby? And oftentimes they'll say no. And they say, well, what did they drink? And in my clinic, we have a lot of Medicaid patients. So unfortunately, we have a higher volume of formula usage. And it's always on formula. What kind? Well, I don't remember. What color was the can? Oh, it's purple. Okay. Alimentum. Alimentum is a hydrolyzed formula. That means the child had milk protein intolerance and soy protein intolerance. So I'm like, okay, let's just take your kid off dairy for 1 month. And I want you to increase the volume of fiber and whole natural foods daily. And of course, we'll put them on medicine if we need to, because they're acutely that sick. So for example, if a child is wheezing to beat the band, they will get a steroid pulse dose. And we might even put them on an inhaled corticosteroid, a drug that they put in an inhaler to their lungs to cool down the inflammation if I think I need to. But I'm still doing all that other stuff. Because what invariably happens, if I'm right, and it's a milk-based issue, as soon as you remove that, increase the dietary cofactors through healthy food, all of a sudden, all the symptoms are gone. They say, okay, let's get rid of the steroid. And then if they don't recur, bang, done, end of story. And that's happened more times than you can imagine. And again, I'm always looking for eczema, colic, constipation in the older kids is a big sign of milk protein intolerance. Chronically congested, but their allergist tested them and all their IgE testing for allergies or skin testing was negative. My kid has allergies, but every test that the allergist ever ran was negative. That's milk, till proven otherwise. So that's the first big thing I'm going to go after. Then If there's no history of that, then I'm going to say, okay, well, do you have true allergies? Is it seasonal? Do you have dogs, cats, dust? Is there something else that's in the environment that I can get rid of? Back in the early 2000s, late 90s, I ran an asthma clinic. And one of the things I used to tell parents to teach them to understand this topic was think of asthma as a glass of water. If the water's spilling out, that means you're sick. That's the wheezing. So what's filling up that glass to help you spill? All right. So we go through the things that'll do that. Viruses will trigger a heartbeat, but that's something that's hard to control. But oh, by the way, if milk's a part of that, we definitely want to pull that out. If there's smoking in the house, vaping in the house, Glade plugins, if you live near a farm or a factory where they're spraying stuff, if you live near woods where they're burning stuff, all that stuff we try and pull out and then watch the water level drop. So when they get the virus, they don't wheeze, right? So it's all about reducing the antecedent exposome triggers that drive the inflammation that we see of as the disease asthma that requires steroids. It's the same thing with ADHD, same thing with every other disease. If you go and get upstream to the reason why they're there, the drug usage is minimal or not at all. And that's the beauty of functional integrative medicine as opposed to allopathic, straightforward drug first medicine.
It's awesome. Do you recommend that if there are environmental triggers in the air, that parents consider things like HEPA filters in the home?
100%. So two things I recommend all parents buy if they can afford it is a under sink filter for their water, their drinking water. I want all of their drinking water filtered with either RO, reverse osmosis. And if that's expensive, if that's too much, try for charcoal at least, like a good charcoal filter, and change it out every 6 months like it's recommended. And then definitely a air filter in the child's bedroom, HEPA filter in the child's bedroom for sure. And then in their main play space, if they're always in the den, absolutely suck that out. And then I'll probably jumping ahead a little bit here, but while it's on my mind, sublingual immune therapy. I absolutely 100% recommend sublingual immune therapy. There's a phenomenal company in Wisconsin called Allergy Choices. And so what we do is we draw blood, we get IgE specific mediated disease issues. So we find out the child's got IgE antibodies against, let's say, dog, cat, dust, and grass. So I send the results off to this lab in Wisconsin, in La Crosse, and they develop a sublingual glycerin with these proteins in it, in fragments, put it under the tongue, it absorbs through the tongue space and starts to retrain the immune system not to be irritated by those things. It works phenomenally. My own son had to use it for dust. And within 6 months of being on sublingual, he's stopped sneezing completely, no meds, no nothing. And so Allergy Choices, highly recommend them. They don't pay me any money. I don't have any financial interest. So you're not getting a biased opinion here. This is after thousands of kids on their sublingual, fantastic stuff. Downside, not covered by insurance. I'm not going to say why I believe that's true because I'll make some people mad, but it is part of the way medicine runs things.
All right. You said something about ADHD a minute ago, and this wasn't our plan, but we have to talk about this because we're running right now the 6-week ADHD boot camp with Dr. Greenblatt and Kelly Heim. And I'm having so much fun talking with all these clinicians about ADHD. But you mentioned if you treat the root cause, you can often reduce the need for medications. What in your mind is the root cause of ADHD, and how do you help parents treat their kids?
So James and I actually talked, and I love the way he sees the world, and I agree with him. James Greenblatt is a brilliant psychiatrist up in the Boston area. And to your point, let's first get this out of the way. ADHD is not a disease. It's a mismatch of our current environment and the history of how kids should be living. If you think about it, the attention deficit that we call a disorder was actually highly beneficial thousands of years ago because these were the explorers. These were the folks who were willing to do really interesting things, impulsive, but that's a huge evolutionary benefit. The folks that are less likely to be ADHD are the ones who are more likely to want to sit on their farm, not challenge anything, not do anything. So let's just get that out of the way. I don't like calling kids with ADHD disordered, right? I'm the poster child. If you open Webster's dictionary and you look up ADHD, my picture is there. It's a completely dysfunctional child.
That was you in that book?
Yes. I tell the story. One of the greatest days of my life and probably the worst of my parents' life was the day when I was in 3rd grade and I walked into Hagen Elementary School and they had all the instruments lined up. Right. And I'm walking around and at the end was the drums and at the front end were the strings. And then it go to the piccolo and the flutes. And my sister chose the flute. My brother chose the violin. Yeah, not yours truly. Yours truly is walking down. Parents are passing this. Oh, this looks great. How about that? How about this? Nah. Get to the snare drum. Bang, done. Give me that thing. And my dad died 2 years ago and my mom's still alive, but they took it on the chin. They allowed this little whippersnapper kid to have a drum in the house to bang around, make all this noise for years. And then eventually I went over to a full set. I can't even imagine what it was like to listen to me try and play like AC/DC was the first stuff I tried when I was 13. Like, ugh, but to the point, that's what ADHD kids do. So long aside, but so James's way of looking at the world, I think, is ideal, right? So these neurochemical changes that allow us to be impulsive and be inattentive, but hyper-focused on that which we love is not a problem unless it gets in the way of your ability to succeed in life. So I tend to layer this into, again, the 4 pillars. Is your child sleeping? If they're not sleeping, they're inattentive. It's just, sorry, you just won't do well if you don't sleep. So piece number 1, make sure your kid sleeps adequately. Number 2, are they eating healthy? You need the cofactors for your brain to work. 30% of every calorie consumed by your body is burned in your brain or more, depending on how much you're thinking. So are you putting in B vitamins for fatty acid oxidation? Are you putting in magnesium and iron? Are you putting in Krebs cycle pieces, right? So that I'm going to focus on heavily. Then I'm going to work on exercise. It's very clear that exercise drives cellular activity in your brain. If you don't move a lot, the blood doesn't flow a lot, and you don't clear out the toxins and other things. And again, that's another sleep piece. How do you clear out the toxins at night? When you sleep, lymphatics turn on during deep sleep. So you want to make sure they're sleeping again. But food's big, exercise is big. And then the other one, toxin avoidance, right? We've got to get these kids away from chemicals that are bad for the brain. I mean, one of the ones I was talking about is the old Lewis Carroll story, Mad as a Hatter, right? So if you think about Alice in Wonderland, the hatter, Hatter, they used mercury in the felting process to make hats. Well, the mercury absorbed through the skin is highly volatile, and you end up going to your brain where it's fatty tissue and it gets in there and dysfunctionally disrupts the pathways of the brain. So you end up with neural damage, and we call them mad, crazy. Well, it's actually, no, it's called mercury toxicity. So we want to make sure kids aren't getting any toxins in their brain. And the 2 biggest ones I think of is mercury and copper, right? So we don't want a lot of copper in the brain. Well, that's what Dr. Greenblatt thinks, and I agree with him. One of the reasons zinc is a problem is because they're yoked to copper. And if you have too much copper coming in through copper pipes or some other source, then you're going to need zinc to fix that. Let's look at where you're getting that. So that's also, again, why I want filters on water.
Thanks. I love that. So I want to give you the floor. Like, get up on your soapbox for a second. Like, what have we not covered here that is on your heart or on your mind that you feel like parents who are listening or other docs need to know right now?
Whew. I mean, parent up, parent up, parent up, parent up, parent up, parent up. Let me say that 9,000 more times. Parents have to become parents again. You are not a friend to your child. You love your child so much that you're going to parent them. And parenting is conflict. Conflict needs resolution, and it's only resolved through love and touch. So when you criticize your child, which I hope you don't criticize them, but when you tell your child something they don't want to hear, they'll hear it as criticism. Always begin with, I love you, but I love you, and this is not okay. I love you, and your decision to do that is not okay. It's not going to ever change that I love you, but that's not okay, and I'm not going to allow it. When you're 18 and you're not living here, you can do whatever you want. I have 18 years to help you become the best version of yourself. And again, you're doing the work. I'm just guiding you. And so my parents did it for me, and I'm going to do it for you. And I'm not going to abdicate that job one iota. That would be the thing I would say to every single parent out there. I am deeply distressed at the lack of parenting in the world, especially around screens. I go to restaurants and 4 kids are on screens. The 2 parents are just maybe talking to each other. Maybe they're on screens. That's unacceptable. My children were not allowed to have screens at the dinner table ever. And when we went to restaurants, they had salads. And people were like, how'd you get your kid to eat a salad? They do. It's not an option. You don't have an option. You don't eat the salad. You don't eat lunch, right? Then you go home hungry, and then you'll call me when you're hungry and you'll let me know. And that's not a lack of love. Actually, that's so much love that you're willing to do the hard thing. Because what's the easiest thing a parent can do? Do nothing. Just let your kid be free range wild Indian, right? Wild child, just going crazy, right? That is not parenting. That is letting your kid live without boundaries, and those children really suffer. And you can see that. That's an anxiety-provoked disease waiting to happen. Boundaries are useful, effective boundaries. We all know if you give too many boundaries, you have the child. Like I remember a young man when I was in church growing up that his father was a deacon and he was a kid standing up front with the long hair and the Megadeth t-shirt, and he looked like he was rebelling 1,000%. He was. He didn't like the control. So don't over control your kids, but parent up on sleep, parent up on food, parent up on screens, parent up on exercise, parent up on time you spend with them. So clearly don't sit on your phone when you should be spending time with your child. So I think that in and of itself would solve so many problems. Like all the conversations we're having in general still revert back to how do you parent your child? That's my soapbox.
I really want more tips around this. Like, are there books, are there podcasts? Because part of what we're seeing now is maybe people grew up with parents who parented just like you said, and now those kids are having their own kids and they may not have a model for how to parent like this. So, what resources do you recommend parents to who want to learn how to parent up?
Best book is written by Alison Gopnik, Gopnik. She's a professor at Stanford, if I remember correctly. And the book is called The Carpenter and the Gardener. And it is an anthropologic, and you'll get this, unfortunately for me, you're going to always hear the word anthropology with me because I am a huge fan of history. And anthropology is the way we learn from our own ancestral genetic understanding. And so she is an anthropologic behavioralist. And she went back and looked at where and how humans and primates existed as a family unit, as a parenting structure, and all of those things. And her book basically drills it down into two types. There's the carpenter parent and there's the gardener. The gardener is the parent that provides soil, light, water, micronutrients, and safety, and doesn't care which direction the plant grows. So if that plant happens to grow sideways and up and around and tortuous, it's totally fine. At the end, they get to the light and they get to what they need. The carpenter parent, I sort of liken to that recent book, The Chinese Dragon Mom or Chinese something mom. I can't remember. I'm probably butchering that. But that book was sort of the essence of the carpenter. I am going to chisel. I'm going to measure. I'm going to nail. I'm going to do everything perfectly so my child ends up perfect.
Tiger mom.
Yes, that is not in the child's best interest. That's your best interest. And as a parent, we need to check our need to achieve a goal as opposed to what is a child's goal. And the child's goal is simple. They want to be loved. They want to be safe. They want to be fed, and they want to be let loose to explore the world, right? They want to be in the backyard, digging the dirt, throwing things, doing this, learning through relationships. They get into a fight with their sibling. My job is not to fix the fight. My job is to be there if something gets really sideways, to protect them. My job is to counsel them if they need counseling, but I'm not there to break up the fight. If I'm not in the room and the children are fighting and they come out screaming at me, I don't know. I wasn't there. So how am I going to adjudicate that process? So I look at them both like my kids knew this. If they came to me and they were both arguing and I never saw it, I said, I didn't see it. So if you can't resolve it, I'll resolve it. And you're both going to suffer. Right? The consequence with both of you, because I wasn't there. And guess what? They stopped bringing stuff to me. And they sort of self-resolved. They learned how to be in relationship with each other to make it work. Because if dad got involved, it generally wasn't good for either of them. Now, if I witnessed it, that's easy. Then it was singular to the person that was the perpetrator of that which wasn't good. So I think to me, that's the biggest piece of this entire world structure we live in. As a pediatrician, I would love to see more focus on parenting. I think that it's a crime that the United States society, government, whatever we want to call it, doesn't have parenting classes a requirement for having a child. You need a license to fish. You need a license to drive a car. You need a license to pick your nose, but anybody can have a child with no education around how it is to be an effective parent. And then the last thing I'll lean on, be careful to look in the mirror of that which you had struggles with in your own childhood and you're trying to fix in your kid. It's not your job. You're not your job to fix your own wrongs through your child. And so be very cognizant of your own weaknesses, your mirror of choices. And I've been very careful to watch those things even in myself because it's so easy to go, well, I did this wrong. I don't want you to make the same mistake. Well, maybe they need to make the same mistake.
Yeah, I think it was Carl Jung who said, there's no greater influence on the psyche of a child than the unlived life of their parent.
Ah, it's beautiful. I forgot that one. That's great. Look at that, digging that one deep in the memory banks. That's awesome, Kate.
I want to thank you for your time today. You're always our expert on peds, your time today, but also the work you're doing in the world. And I want you to tell everybody, where can they find you if they want to come to your practice, but also you do so much free education. Where can they find you and where do you put that out?
Sure. It's a labor of love. Anybody can get it anytime. SalisburyPediatrics.com, www.salisbury pediatrics with an S on the end.com. That website has the links to everything. There's a newsletter that's every Monday morning, comes out at 5 a.m. that I write every Monday, and it's on all kinds of topics. It's at times science heavy, but I will let you know that so you can skip past that to the take home points so that the parents can get all the deep knowledge they want. But like I just did a big part on circadian biology, like we talked about. I actually talked about that article on vaccination. Like I'm encouraging parents to try and get morning appointments now for their vaccines to get a better response. So that's what all this stuff is about. The podcast is Dr. M's Women and Children First. That is on Spotify and Apple. And so that's an interesting one because that's half guests, of which you are one, soon to be released, which I'm super excited about releasing because that was so much fun to do. But in between those is me audio casting the newsletter. So if you don't want to read the newsletter, you can listen to it. Unfortunately, you have to hear my voice again, but that's the way it is done because I do everything myself. I don't have a team. And so part of that is to keep it cheap and free. I do it all myself. So you have to struggle through my voice. And then coming to the practice, anybody who's in North Carolina, I'm in the north of Charlotte area in a place called Salisbury. And then the last shout out, which I'm super excited about, is this new company we formed called Children First of North Carolina, where we have 55,000 Medicaid kids now getting state money to help their social determinants of health improve dramatically. And that has been my labor of love the past 2 years and hopefully the next 30 so that kids get everything they need. And the last thing I'm going to say, and then I'm going to really shut up. I don't understand why politics does what it does. How are we not all screaming for clean air, clean water, and clean food before we scream about anything else? We should be firing every single person who is not speaking to those three things because that is where all of our dysfunction comes from. And so if I ran for office, which I won't because I'd be assassinated, I would 100% run on that ticket and I wouldn't stop until the companies that are dysfunctionally hurting our children and us were dealt with.
Yeah, I think we need we probably in a year or two, I would love to see, are you guys going to publish the results of like what you're doing with this new initiative?
Yeah.
When you do, let's have you back to talk about it because I think that is going to change the lives of millions, really.
Yeah. It's the way medicine should have been forever. And it wasn't. And at least in North Carolina, which I'm grateful to the Senate and the Assembly for choosing this path to give us the money to hire the people to do it where the boots are on the ground. Like I'll give you a quick story. There was a young female teenager who rolled in who I'd never met before, who was clearly losing weight. And her family loved her very much. And we were talking about it. And it was clear that she was going to need inpatient admission. This was not one that I was thinking could do outpatient, but it was going to be a struggle. So I enlisted our care management team, which is made up of folks who were in the social work environment, also RNs. And they came in and met with a family while I was able to move on to other patients and spent 2 hours figuring out exactly what this family needed in order to get in the perfect environment. And so she could then thrive. I could never have done that. One, I'm not tapped into those systems the way they are. Two, I didn't have the time. Everything about this was a win-win-win. Nobody lost. I won, the team won, the patient won. And at the end of the day, who should win? The patient. And far too often in medicine right now, the patient isn't winning because the patient's not at the center. Money is at the center. Money should never be at the center. As soon as money enters the center, people make bad choices around health. So yeah, it's cool. It's awesome. I'm just so grateful for North Carolina state folks to allow us to do this. And it's been an absolute pleasure.
We'll have you back to talk about the results from that in a bit. Thank you for doing that work too. So everyone go follow Dr. Chris, go see him if you're nearby with your families, and we will talk to you soon. Thanks for all the work you're doing in the world.
Same to you, Kate. I'm just grateful. Ever since that day we met, it's been a pleasure to have like minds and spend the time together. And for what you're doing, I just want to applaud you. You're doing amazing work, and I'm grateful to be here with you.
Thanks so much. We'll keep doing it together.
Amen. Take care.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.